Welcome to the BenitoLink 2020 Election Forum Series. My name is Ana De Castro, and I'll be moderating today's candidate forum for San Benito County Health District Zone 1. We are joined today with Ms. Hernandez and Ms. Postigo. We will begin with Ms. Hernandez for her opening statement. Ms. Go ahead.
Good evening, and thank you, BenitoLink, for this opportunity to speak and answer any questions the community has pertaining to San Benito Healthcare District Hospital. My name is Jeri Hernandez, and I am running for re-election to the San Benito Healthcare District 1 Board. I have been a resident of San Benito County for 34 years, and I've raised my family here as well. I've owned and operated a home decor and staging company for over 11 years, and I'm an active member of my community.
Yes, my name is Susan Martin Postigo, and I'm excited about running for the San Benito Healthcare District Zone 1 board seat. I've been a resident for over 50 years. I'm married to Robert Postigo. We have 3 children and 2 grandsons together. I've owned and operated a healthcare billing company for over 30 years. I also have served on the foundation board, and I am the treasurer for a nonprofit which is dear to my heart, Growing Hearts, which is a supportive employment for adults with disabilities.
Rural hospitals all over the nation are struggling. What ideas do you have to make Hazel Hawkins a successful and innovative hospital?
Some ideas I have would be to have the hospital be contracted with additional insurance companies so that our community isn't having to leave our district to receive medical care. There's a few healthcare plans that the hospital is not a participant of, and which then our citizens have to leave the area for their medical care. I also think that we could use some additional specialists. I know that the hospital does recruit specialists. I think we need a urologist full-time here. I would like to see some more pediatric specialty physicians here. And I think we need to increase the patient satisfaction in our community so that they feel comfortable going to Hazel Hawkins, which I hold dear to my heart.
I also believe that we need to reach out to the community for what their healthcare needs are so that they can understand what our hospital can offer them. Working with Congressman Panetta and with Assemblyman Rivas on a state and local level, we've been able to acquire critical access, and that is really helping us to reach out to more primary care physicians to be able to keep people here in Hollister. A lot of people travel out of the community to work. So we'd like to be able to know what their needs are here. And when we can, reach out to them and let them know and educate the public what we can offer them, I think that that's going to help broaden our perspective of what we can do and achieve in the future.
Hazel Hawkins recently gained access designation, which meant reduction in the number of beds. How does this impact the community for better or worse in light of the COVID-19 pandemic?
That's a good question. Critical access did bring us down to 25 beds, and we have been able to successfully facilitate our hospital using that amount of beds during COVID-19. We do have, special protections for the public when it comes to this pandemic and being able to house individuals in our hospital. So having critical access and reducing our bed size has not been a factor in keeping COVID patients from coming to our hospital. We have the resources, we have a lot of PPE that all of our employees can use to help take care of these patients. And we just don't feel that critical access has been a hinder in what our hospital can provide.
Well, looking back at the history of the actual patient capacity, I don't think that we have achieved 25 beds for numerous years. So I don't think that the pandemic that we're going through now has affected the critical care access, because I don't think we're impacted here in our rural community as some other hospitals are. I think I've been told that they had a special area obviously for the COVID-19 patients, but I don't think the critical care access has had any result on patient capacity.
What kind of experience makes a valuable and competent board member, particularly when you take into account the hospital's sizable budget? You'll have 1 minute to respond.
To be a valuable board member, I think you should have some sort of experience in the medical financial field. I realize that it's very difficult for hospital districts and independent physicians to continue within the healthcare as we are now. So I think for being a board member, if you have some business experience in the medical field, you know the difficulties that they're going through, and you can try to use your experience to help them.
Well, you know, to be a valuable asset to the board and to be financially able to answer the questions that, you know, are needed for our hospital. I came into the hospital not having any hospital background, but as a business owner, I understand, you know, profit and loss statements. And I understand that when you are in a critical situation where you need to have funds coming in, it's our duty to reach out to whatever resources that we can to help us, you know, obtain those resources. And from the 10 years that I've been with the hospital, I've learned a great deal about what our finances are and where we're going. And I know that we're on a positive upswing now with critical access. I know that we're going to be able to reach out to other primary care physicians, and we're going to be able to keep our finances in check.
Thank you. We'll now move on to closing statements, and you'll each have 30 seconds to respond. Ms. Hernandez, we'll start with you.
Okay. Thank you again, BenitoLink, and thank you to the community. If I'm elected to serve another term, I will continue to be a patient advocate for every resident of San Benito County. I believe that no matter what you are going through, you should receive safe, accessible, top quality care. I will also serve as an advocate for all hospital employees. They deserve a work environment that respects them and allows them to focus on patient care. One of my top priorities will be establishing an oncology department at Hazel Hawkins. I lost both my husband and my son to cancer, and I understand how emotionally difficult cancer treatments can be for patients and their families.
Ms. Postigo, your closing statement?
Yes, thank you again, BenitoLink, for hosting during this difficult pandemic time. And I would just like to say that if I was elected, I do bring medical background as well as owning my own business to the board. I also could read a profit and loss statement. I understand what the hospital is going through. And I'm just hoping that people would trust me and vote for me. Thank you.